Hi, I'm Karen Burgess. I'm the Executive Director for the Michigan Dental Association. Thanks so much for joining me virtually. It's been about a year since we were all together at Dentistry in the D, and it's been a very, very productive and yet very, very disconcerting year. I think you'll all agree. I'd like to talk a little bit about the Michigan Dental Association strategic plan as we come into the last year of this plan and start thinking towards next year. So as a reminder, I would like to remind you that our four overarching goals for the strategic plan are to deliver exceptional member value, increase member participation, assure organizational sustainability, and maintain capacity to meet member needs. We have been doing great on all these items, and I'd like to talk to you a little bit about how we've done and also how we've pivoted in the new reality of COVID-19. It was very exciting at the end of last year when we did our Michigan Dental Association member opinion survey. It was the first time we had included the Net Promoter Score as a measure. And on that 1 to 10 scale, we asked our members, how likely are you to recommend MDA membership to a peer or colleague? The Net Promoter Score uses the high ratings minus the low ratings to come up with a single score, and you can see the MDA got a 49. Now, when you consider that associations overall in the United States average 21, then 49 is a score indeed to be proud of. And what that told us is that we were on the right track. The strategies for member value included a focus on CE for dentists and dental teams, providing practice management resources, and positioning the dentistry and MDA positively with legislators and the public. And you can see that the tactics underneath showed you a focus on MDA annual session and improving that, completing a whole new set of resources for dentists who are nearing retirement age, and then focusing on our public awareness campaign, teledentistry, and specialty recognition for the recognized specialties that Michigan doesn't recognize. So we had made a lot of great progress with those things. And then we had the new reality. As COVID-19 came in and started to loom, we recognized that what we were doing before was not going to be what we needed to do going forward. So you can see our new reality is when you look at CE for dentists and dental teams, we had to reschedule our annual session in Grand Rapids this year. We knew that this was going to be probably a record-setting annual session, so it's quite heartbreaking and a disappointment. On the other hand, we have rescheduled it for September, and I'm very hopeful that it will be a success at that time. At the same time, our members had great need for very specific information about how to navigate this new reality. So we put in place a series of free webinars that dealt with a lot of the nuts and bolts of the coronavirus pandemic. And we've seen just a tremendous response to that opportunity. When it comes to providing practice management resources, we'd actually completed our late stage career resources, and they were getting great feedback from our more senior docs. That was complete. But the new reality is we had to create new resources, new web pages, new information on a daily, if not hourly basis related to COVID-19. And we're continuing to do that. Finally, when it comes to positioning dentistry and the MDA positively with legislators and the public, we kept on with everything we were already doing, but we had to pivot to policy related to COVID-19. And at this point in time, with the resources we've put forward, it's the Michigan Dental Association's position that now is the time for dentistry to reopen in Michigan. We also are retooling our public awareness campaign to help the public understand that now's the time to focus on returning to care. So when it comes to increasing member participation, you probably wouldn't be surprised after seeing that member value scores that our membership is up as well. 77.1% of all active dentists in the state of Michigan are MDA members at the end of last year. And we did a great job with retention, with increasing our market share in some of the components that have the largest number of non-members. And we saw an uptick in participation among diverse dentists and LGP DSO docs. Our new reality membership this year is lagging a little bit, and we do have some concerns about next year. We're down about 100 compared to the number of active members we had last year at this time. To make it easy for members who have not yet paid their dues, we've offered extended payment through September. We've also decided not to put forward the resolution to match the ADA dues streamlining categories. And we know that dentists, new graduates, and dental students right now are all very challenged about what the future is going to look like. So we wanted to make sure that we make it as easy as possible for people to maintain and become an MDA member. I will tell you that despite the pandemic, we are still getting applications every week. Now let's talk a little bit about financial sustainability. We had been doing quite well at the end of the year last year. Our 2016 through 2020 budgets were all in the black at the time we did them. We had put in some periodic small increases in dues to try to avoid any future sticker shock. Our non-dues revenue, which is a great opportunity for the Michigan Dental Association, was up almost 20% since 2015, which is great. And we were seeing positive investment returns compared to our benchmarks. So our reserves were very high compared to our expectations, over 90% compared to a 75% target. Our new reality is things are not so rosy. We're expecting almost $500,000 in revenue shortfall this year. We were able to cut about $400,000 in expenses. And here at the Michigan Dental Association, I can tell you that one of my strongest wish for our legislators is that they make 501c6 organizations like the MDA eligible for a PPP loan. We currently are not, but I hear that it is coming in the next round of legislation. So we will be looking for your help and advocacy for that. Our reserves continue to be over 75%. And of course, the worry is that when will the market recovery happen? 2021 budget, I'm not going to lie, is going to be painful to put together, but we have pledged to be fiscally prudent, and we will be doing so. So, as I say, the things that you can do to help with that are A, attend our annual session, and B, participate in our action alerts. Greatly appreciate it if you do those two things. When it comes to organizational capacity, we're focusing on component leadership and member service, having a strategic focus for our board of trustees, and enhancing our MDA staff capacities. And these are all things that we've been working on very successfully in 2019 and through 2020. That doesn't mean that now that 2020 is here, we aren't seeing some changes. So, for example, we will need to prioritize component support to do what is most needed for the components. Our governance now is just like you are today, virtual and mostly by Zoom. Our board has been meeting weekly to address the emerging issues associated with the pandemic, and all our staff are working remotely. So we've been very productive, but in a completely different way than we've had to be before. As we develop our 2021 through 2025 plan, this summer was the time when the board was scheduled to go on a strategic planning retreat. We still do plan to do strategic planning. We're just not quite sure how we're going to get together. And as we develop our 2021 through 2025 plan, I think you can see that environmental scanning and seeing the future is going to be the big challenge for the MDA Board of Trustees. Questions include, what will our next 4 years look like? What will be the likely impacts of the pandemic? Will patients be comfortable coming back to dentistry? What will be the changes in how practice is run? And what will be the impact of things like testing and vaccines? And how will that change what you do in your practice every day? And what about the economics of everything? What will happen as we move forward? We have almost a quarter of our population in some locations is out of work. How will that affect the demand for dental care? And then when we look at the association specifically, we want to make sure that we're doing what our members value. And what will they value most going forward? And how can we best fulfill our mission of helping members succeed? I think you would all agree that the next year to 18 months is a time of great uncertainty and a time of great opportunity in some way if we can do what we're here to do and help our members succeed and the public have excellent oral health. And I want to say thank you for all you do to the House of Delegates, to the Board of Trustees, and to everyone who works so hard across the state of Michigan for organized dentistry. You know, your active participation and support of organized dentistry is what will ensure success for dentistry, for the MDA, and for our members. So thanks again for being with us and for all you do every day going forward. I appreciate it.